How's everybody doing? Is there a clicker? Because y'all, I like to wander, and me being up here with nothing is not a good scene. So thank you for the introduction. It's really nice to be here. I work for the Department of Public Health, and I'm really thrilled and honored that Georgia Memory Net would have me come up and present and talk a little bit about what we do in public health. Next slide, please. All right, so in 2011, taking it back before 2018, in 2011, the National Alzheimer's Act was passed, and that really kind of set the frame for the need for a national, easily distracted. Okay, for the 2011, when the National Alzheimer's Act was passed, really set the stage for a national framing around this topic. We were extremely pleased when in 2018, the BOLD Act, which is building our largest dementia infrastructure, when that act was passed. And what that really is bringing public health into the fold of this set of diseases and declaring that this is indeed a population level issue, an issue that affects a certain group of Americans that we need to be addressing within public health. All right, so what are your traditional public health roles? Everything you see in bold on this slide is what we do in public health. We do a whole lot of data stuff. We love, love, love to count things. We like to work in prevention. It'd be really nice to put ourselves out of a job and just not have all the things that put us in the hospital or take us to the morgue. That's super good. We like to educate people. Least effective, most fun to do. Everybody likes a health fair. You get to give out things and talk to people, right? Training. We like to train our providers, public health professionals, first responders, because those are also part of public health, emergency response, nurses, all the people we like to train. And most of all, what we do in public health is that we are a bridge, and we do that through partner support. In Georgia, we've been a bridge, please read no funding, for a very, very long time. So when we switch this a little bit and talk about all of these roles within the framework of dementia and Alzheimer's disease, you have the rest of the text on this slide. We can inform policy through our data. We can promote risk reduction activities. A lot of what public health does is chronic disease management, screening, assessment, those really good things that we hope are helpful to you, primary care physicians. We can talk about the warning signs of dementia, tout the benefits of early detection, but what is early detection? And my God, there's a stigma. So it gets pretty deep pretty quickly, but these at the baseline are things that we do. Specifically, what does Georgia's Department of Public Health do for our healthy aging work? I want to pause here a moment and acknowledge who are the dementia care specialists in the room. God, that light is terrible. Who are our friends in the State Unit on Aging? I see at least one of you. Sorry to make you raise your hand, loves. Two of you. Yay. All right. These folks make up our aging network. Quite frankly, as primary care physicians, y'all also are part of our aging network because you're doing this work working with an aging population. So in public health, we are working to be a bridge between different types of partners. We are writing grants. We were successful in both rounds of CDC BOLD funding so far. The first year was 3 years from 2020 to 2023. Talk more about that in a moment. And our most recent award, which is from 2024 through 2028. I think I can do math. Been a long day, y'all have fed us a lot. It's really good. But the overall goal is to create a systemic approach to this issue. And that's what it is that we're working to do. So what is our challenges? What's our innovation, the secret sauce, if you will? So we're a decentralized state, 159 counties of awesomeness that may or may not talk to each other on a given day. So that means, on a positive note, but an overwhelming note, that there are a lot of ways to divide and connect. There's also the potential for competition, and there's a whole lot of silos. We're very comfortable working in our lanes. We have to also keep up with the progress. I think that our Georgia Memory Net friends have done a fantastic job of outlining for you what things are moving, how fast they're moving. Certainly the pharmacological advancements alone right now are an overwhelming blur of what's coming down the line, and it just continues. So what do we do in that? When do we do it? How do we do it? Who do we talk to about it? And then finally, establishing a strong system. We've got to talk to one another. We've done some of that today. We'll do more of it tomorrow. And we need more events like this, more discussions virtually and in person to keep these discussions going so we have a sense of what works in one area. Not that it's going to work in the other 158 counties, but so that we know what may not work and what those challenges are and what we can anticipate for a given group. So it seems very nice linear type of thing. The reality, go back. The reality, and we described it this way, is that it's more like an octopus. I can't even find an octopus. Y'all, the icon in PowerPoint in Word is a 4-pronged octopus. They have 8 legs. They have 8 legs. And I said, well, this just describes everything beautifully. So that's 2 octopi right there in front of you to make 8. Really fantastic. The hardest part of an entire presentation is finding an octopus to show you things. Everything that we're doing, we are trying to, and you do this in your practices. You are thinking about your partners, your patients, the care providers. How are you going to bill? What are you going to bill? What are the policies around this? Have things been updated since the last time you checked the web on a given potential how you interact with a patient? We don't know. That's what we're trying to do and get to be in some semblance of organization and ways in which we can talk to each other that cross the different ways that we talk about things. For a very long time, we talked about motor vehicle accidents, which makes my public health heart just cringe. It's a crash, because that's what my data says. So we're trying to do that. So I know that when you say patient-centered and I say patient-centered versus when long-term care says patient-centered, we might actually be talking about different things. And so having those conversations becomes incredibly important so that we have a better sense of where the commonalities are and where we might stretch or grow how we currently view things so that it's more comprehensive for all of us. All right, so in an attempt to not be an octopus all of our lives, CDC at the federal level came out with the Bold Healthy Brain Roadmap, which is quite lovely. Talks about partnerships and data and education and not just educating the public, but also educating different types of professionals. So, I'm from Ohio, buckle in. You thought I was already talking fast? Here we go. We're going to first talk about public education on brain health, which I really hope that as we're doing more of this, we can talk about it and normalize it and not have such stigma attached to it. We're looking at sustainability and we're looking at increasing community clinical linkages. So everyone here now knows a little bit more about Virtual Dementia Tour. I did, when I did Virtual Dementia Tour, I discovered that I might mumble louder than I thought I did. Somebody else came in and was like, who's that weird lady that keeps talking to herself? Yeah, it was my brand new employee that I hadn't met yet. It was great. But so we're doing Virtual Dementia Tour with different types of groups. Has anyone here heard of ALTER? Besides the experts in the room. Okay. ALTER is an approach to reaching the African American faith-based community, looking at being dementia-friendly, but also teaching that group with their really amazing core familial values about what it means to care for a person with dementia, what it means to have dementia, and doing so in a way that's culturally competent, which is absolutely stunning. They actually have a national, and I think they're working on an international presence right now, but they got their start right here in Georgia. So it's a really nice community way for us to reach out and reach different populations. Savvy Caregiver, which I believe is being talked about, but that is training for caregivers. There are so many different programs available for caregivers. They want it all, and they want it yesterday. So where we can connect them to different resources is really where we will all win. And one of the things that my team is trying to do is figure out what's there and what we can do. Think About It campaign is just that. It's a media campaign that our team developed, and it is about thinking about risk and how we deal with it. So within our Think About It campaign, my kid's playing soccer, so we're just going to get rid of this. And I'm sorry for the front table that now has to listen to that thing buzz. All right, so action items for primary care physicians. You've heard a whole lot about telehealth referrals. We're going to talk a little bit more about that. We want you to know your local public health partners. Who here that is a physician is already partnering with public health? I know the folks in the back are. Yay! Your public health does a lot more than just vaccinations. We're a little tired from COVID still, but we're okay. We're here. We're recovering. Thank you. We do chronic disease management. We do vaccinations. We do a lot with women's health and children's health. There is a growing desire within public health to do more with this specific population. And so we're working to train those folks to do that. Some of our groups, like our District 4, Lamar County folks at the back of the room, are also doing virtual dementia tours. They're also working with Alter and other groups. So the goal is to stay informed, which is why you're here, so yay you. But maybe go back home and inform your partners that don't get the chance to come to these types of events. And we're happy to provide you with resources to do that. So let's dive into telehealth a little bit. We know that our friends at Georgia MemoryNet, sorry guys to toss you into the bus willy-nilly, but I'm gonna. We talked about with them and others about telehealth for a really long time. And then COVID hit. And suddenly it became paramount that we find a way to do things to see patients. And so for everybody, no matter what your discipline was, suddenly you were doing telehealth. Good, bad, ugly, and indifferent, that's what we're doing. So what we've tried to do with this is really figure out what it is that we can do. So our memory assessment clinics, we can partner with them to realize the telehealth strategy, which we've done. We have a platform, and we are leveraging their best practices because not everyone in public health is clinical. A lot of us are programs. So to leverage those existing clinical best practices is in our best interest. Our primary care partners, we hope to connect our PCPs and local public health. Our Georgia MemoryNet friends are doing a phenomenal job, we hope. We already know they are because we're here. They're educating primary care physicians on telehealth, annual wellness visits, and how to do more of it, because that's really what we need, is to get more people doing those types of things. And our patient population, we're reaching out to them, teaching them to self-advocate, to ask for an annual wellness visit, to ask for cognitive screen, all those types of things. So we developed a workflow where our primary care physician, is this the light? Okay, so workflow, the primary care physician, that's you lovely people, identifies the risk. They go to a MAC appointment. They go to a second MAC appointment. These are all of our diagnostics. We do a care plan, so we're not diagnosing and audiosing. That's lovely. And they return to our primary care physician for community resources. Public health sits right here in that MAC visit. You see on here, we've got our MACs. Our stars are where we have telehealth tablet sites throughout the state. Rather than, yes, sir. Oh, man. I was having a great time. I was really, see, just leave me alone, Ted. Thank you, sir. Primary care, there's this. I've been doing this for too long. It's Saturday. Here we go. So right here is where public health sits. Rather than go to a memory assessment clinic, let's say you're in North Georgia and you don't want to drive over the mountain, because that's a thing. Even though Gainesville is now a memory assessment clinic, and that is wildly exciting. But if you don't want to drive over the mountain, you now have a couple of options, just a couple so far in North Georgia, to instead go to your local health department. And you would sit at that local health department with a tablet and be connected to your Gainesville or whatever memory assessment clinic is doing that telehealth visit. And via telehealth, you are doing that first diagnostic visit. Then you do your homework in between, blood work, anything else, MRI, all the things that need to happen. And then you could not drive over the mountain again. Go back to your local public health department. Ted, really helpful of you, sir. Thank you. This is so much better. And go back and talk with your memory assessment clinic that is over the mountain and get a diagnosis, get a care plan, start reaching out to community resources. So that's what we're doing. We have 6 active sites: Emmanuel County, Dooley, Lamar, who is here today and in the room. Amazing. We love you. Union, Hart, Lawrence. We are in process with Fannin, Whitfield, Glenn, and Troup counties. This took us a year to work on workflows. Really interesting thing to bridge clinical practice and community stuff and public health departments. Your local public health department gets what's called an origination fee. Nobody's getting rich, folks. It's like $20, but it's a little bit of a carrot for them to participate. And there, of course, because this is public health, a public health nurse does not just want to sit somebody in a chair in an office. I think that's the next slide. So this is what it looks like. You go in a chair in an office. That second picture on the slide, you can see there, those are our people in the background. They were doing a mock visit to make sure all of the electronics worked, the sound was good, that they had enough room in that physical room to have the patient stand up and look at those gait assessments that they do as part of the diagnostic visit. So it's a very simple setup, but our public health nurses want to do more, which is why they're doing things like virtual dementia tours. They are doing brain health education, risk reduction education, those types of things. And we have big, huge, amazing, evil plans to do other things, which I'll talk about in a moment. Telehealth, so again, this is the screen. A lot of back and forth on what's the best WebEx or some other HIPAA compliant tool to use. Everybody uses something different, so that's not fun at all. But we're working on it, and everybody's compromising and talking, and so this is really fantastic. We haven't seen a ton of patients. It's been about 20 or so patients across all of our sites, but we are seeing patients. And that, I hope, is expanding the capacity of our memory assessment clinics. More of those memory assessment clinics, we hope to come online soon to be providers for those telehealth visits so that we can continue to increase access. And at the end of it all, they come back to you, the primary care physician, their home base, if you will. I do know that our Georgia MemoryNet friends, if a person doesn't have a primary care physician, they try to set them up with one, because you are central to this entire effort that we're doing. And I just wanted you to know that. I heard earlier this morning some talk of how do we do the things. Georgia MemoryNet, I'm not getting anything from this other than a yay Liz. Georgia MemoryNet has a wonderful website with referral tools, all sorts of forms that you can use as primary care physicians. And so we sort of dumped all of those into this process as well, so that our local health departments and our memory assessment clinics could work together and have common forms that they use amongst themselves. So what's next in all of this? I want to do annual wellness visits. And we want to do so, must do so in lockstep with our primary care physicians. We need to know what the primary care physician needs, how you need to receive it. I think we might have a guinea pig, wonderful volunteer in Lamar County to help us with that. And is it going to work everywhere in our wonderful 159 county decentralized state? Sure is not, but it doesn't need to. It needs to work in areas where we have access concerns. So shameless plug, if you're interested in that, please let me know. Please let our wonderful friends at Georgia MemoryNet know. And we can talk about ways that we can partner either on a telehealth tablet project or on what is at the beginning stages of actually doing some annual wellness visits where it's needed or access is tough in local health departments. All right, all of that for number one. The rest of this is much faster. We do a lot with data. We like data, we like to count things, I've said that. So this is OASIS. Who else was familiar with OASIS besides our state friends? Some folks, kind of, sort of. OASIS stands for Online Analytical Statistical Information System. Just call it OASIS, your life will be better. This is our public-facing website of deaths, hospitalizations, and ED visits for everybody in Georgia. You can go on here and play around. I know you have no spare time, so I've done some things for you. You are welcome. We can get this to go. Okay, so we had a student, because we love students, look at avoidable hospitalizations and ER admissions. The idea was to examine potential protective and risk factors for folks over the age of 55. Why do we do 55 and not 65? We've been talking about 65 and older all day. Why 55? You're amazing. I also cannot hear. What? I do not want you to feel old, my friend. I promise you I do not. When we did this around driver safety, what we found is the age of 55 to about 64 also had an increased risk of crashes. What are you doing from the age of 55 to 64? You're working. You taking care of mom and dad yet? Right, so you're a caregiver. Maybe still have kids at the home or ones that are refusing to leave, which is what's happening at my house. Yep, okay, yep, that's half the room. Yeah, I see you, I do. So you're doing all the things, and you're stressed and you're distracted. So in injury and crashes, it puts you at a higher risk. And what we're tending to discover over time is that that is the same concepts when we look at other items. When this particular project, we want 55 and older because we want a chance at them to better manage if they're not managing their chronic conditions. Because, oh yeah, 55 plus, you're also managing those pesky chronic conditions, right? Okay, same page. Let me walk you through this with my handy dandy not in front of me tool. Discharge dates from January of 21 through December 31st of 2021. Patients 55 to 64 years of age, patients over the age of 65, hospitalizations and ER visits. We've got our admissions and totals. This is looking at having dementia as an underlying cause, and then what are all of the associated causes that go with it. We okay? We good? A lot of numbers. Don't pay too much attention. It's not that serious. Okay, so we got lots of numbers here for the entire state. So it could, and when our hospital admissions, we were teaching a student, so pardon this bullet, if they're admitted to the ER and then transferred and admitted to the hospital, yes, we might count them both times. Fine, cool, great. All right, come on. ICD-10 codes, yes, there's a lot of them. Please don't strain your eyes. We're gonna move on to more fun things. We want to know what the potential other chronic diseases are. And it's everything everyone in this room already knows. Hypertension, diabetes, falls, and stroke. Where is it happening in our wonderful states? For diabetes and hypertension, represented by kind of an orangey yellow color, and then hypertension for definitely a bluey color. We have our hospitalizations and ER visits, and this helps us understand where these things are happening more in the state, which means when we've got a constellation of diabetes, hypertension, stroke, and falls, when we bring all of those together, we have pinpointed areas in the state where we need to be focusing our prevention efforts, where we know physicians in those areas might be struggling to get their people to manage those chronic conditions. And that's where we want to try and be helpful as you are doing what I've heard today, 12 to 20 things in a 12-minute visit. So these are the ways in which we are trying to help using the data that we so could spend hours and days on. All right, so moving on from data, we are going to talk to and educate healthcare professionals. We really want to focus in on educating our public health workforce. That's a lot of different types of people. There's a lovely online system. No one in this room really needs it. Everyone here knows the basics about dementia. But if you've got a new staff member, you've got a student, you've got a nurse, you could absolutely have them log on to Train Georgia and take that training. Super easy, 4 different modules. We're trying to get more than EMS credits. Seems like not everybody wants EMS credits when they're not EMS. Who knew? I was like, guys, go get at least a CHES credit or something. So our team is working on that. You'll get more than EMS credits soon. But those 4 basic modules about what is dementia, that 101 type of feel is currently on there. We'll be putting additional CEU-based types of trainings on sort of functional types of things, potential assessments and what you could do, maybe how to do the false risk screenings. We're hoping to get those up on here as well, and also get CEUs for those. Virtual dementia tours, everyone is here. We've all been in our fields. I'm not going to belabor the point, but do know that we are using virtual dementia tours for our first responders, for our police officers, our fire, our EMS, our public health professionals, so that they have a sense of what's really happening in the day-to-day life beyond the fun data that we like to play with, beyond all those other things that are very pen and paper, rather than what's actually happening in the world. So great results. Again, Train Georgia, because apparently I can't put slides together, but this does give you the website and all 4 lessons so that you could access that Dementia 101 if you were so inclined. And 4th, educating the public on dementia topics and recognizing the symptoms. Part of our Think About It campaign was things to ask your doctor. What to know about the visits that you're going to be having on a regular basis. Things you might want to tell your doctor. I would love to know from primary care physicians what you would like patients to know or how you would like patients to group things when they come to you for those really kind of time-clogged visits. That would be helpful to us as we're trying to educate the public on it. One of the things that we work in is outreach and partnership within GARD, which is Georgia's Alzheimer's and Related Dementia Collaborative. A little outside of scope for this weekend, but one of the things that we're pretty proud of that was developed a number of years ago is Keep Your Brain Strong. And I think that this really does a nice job of somewhat normalizing having a healthy brain, staying active, doing all the things we want people to do in a pen and paper type of way. So we give this out at the health fairs. I know that some of our partners have taken those fun little squares on this front page and made them social media posts. No real evidence behind that, unfortunately, but certainly when you're looking for something to post to open up a larger discussion, it's a nice vantage point to do. We do a lot of resources for families. Who here has heard of TIPA Snow? Okay. Think Virtual Dementia Tour, for those of you not familiar, but so much more wide encompassing, really getting people to understand what it is like to live with this set of diseases, how it is not okay really for any of us to kind of just approach and get in somebody's face, but what does it mean and how could you more meaningfully and specifically interact with your loved ones, with the person managing these diseases, all of those types of things. The lady's on TikTok and it's amazing. But she also has a lot of educational offerings and families really appreciate those in those beginning stages when they're trying to understand what is happening. We have a lot of state and federal resources, compliments of our Georgia Memory Net friends. Rosalind Carter Institute for Caregivers is always a positive resource for you to provide for your families because they really specialize in working with caregivers. Empowerline, who here besides somebody that works at AAA's knows what Empowerline is? Thank you. 2. Awesome. Yay, not 0. Empowerline is one way in which you can access the area agencies on aging in our state. If you know the answer, well, you would want to say it. If you are not Georgia Memory Net, and you are not in the aging network already, how many AAAs do we have in the state of Georgia? It's 12. We have 12. Do AAAs exist in every state in the country? You should shake your heads, yes. It's good exercise. You've been staring at the thing for a long time, yeah? Yes. Every state in our country has area agencies on aging. A lot of those are Aging and Disability Resource Centers, or ADRC, all about the alphabet soup up here. Every state has them. So whether you are counseling a patient and their caregiver and they both live in the state, or your caregiver is on the phone because they live in another state, AAAs exist. When we talk about dementia care specialists who sit in each of the AAAs in our state, they are funded from our state unit on aging. They sit within each of these 12 AAAs, and they are your connection to all things community. I probably talked too fast. Do you have questions, comments, ideas for me? No softball questions from the middle table. So it can be a challenge. It can be. You can call your area agencies on aging from anywhere in the state. That number right there will take you to the one that's most appropriate. It depends on what your needs are. Part of the reason that you go through multiple layers of people when you're calling the area agency on aging, and really it should be your patient and their family and not you, the doctor, just FYI, is because they actually record you, it's not like a recording that they're using for weird things, but they are building you up with a case manager. And that case manager, the next time you call, is going to know all the things that you talked about the first time. So it's a little painful, and the point is well made and really appreciated. That is why you can help yourself a little bit, not to the full extent of the normal power of an area agency on aging, but you can go to the empowerline.org website and search for resources there while you're waiting for other local resources. If you're really struggling, you can now reach out to our dementia care specialists in the state. It's not a call them first, it is a call them after we've tried to get connected with the area agencies on aging. It's a really great question, and something that I don't know if Mary Lee's in here or not. I'm not with the State Unit on Aging, so I cannot speak with them. Please note that. but they are a very close partner, and they're working so incredibly hard on having their area agencies on aging and that help structure to be connected with the other help groups that we have within the state. One, to be more robust because we want that in our state, but also to be able to be more responsive. It takes time, but they're already making strides and looking at it from an evaluative standpoint so that we have a sense of what it is that really needs to happen, so not so many things fall through the cracks, which is pretty exciting given how long it takes to get things done. Other questions or comments from me? Did y'all know there's candy out in the hallway? Okay, well, at least you're awake. Cool. Thank you so much for your time. I really